I now give the floor to the distinguished representative of the World Health Organization to deliver a United Nations joint statement.
Thank you. Excellencies, distinguished delegates, colleagues, I'm pleased to read this statement on behalf of the United Nations system, including the International Organization for Migration and the World Bank. These organizations are working in support of regions, countries and communities to reduce disaster risk and build resilience under the IGO Framework for Action and the International Strategy for Disaster Reduction. The UN General Assembly has called for disaster risk reduction to be an institutional priority for the UN system and its agencies. The UN's commitment is reflected in the UN Plan of Action on Disaster Risk Reduction for Resilience that was endorsed by the executive heads of 29 UN entities in April 2013. UN agencies have also endorsed the Common Framework for Preparedness that aims to provide support for the development of national and local preparedness capacities across all sectors. The UN system has enshrined in its commitment to countries through country development assistance frameworks. Since 2009, over 50 such frameworks have identified disaster and climate risk as a development concern. The UN system also brings nations together at a regional level through the UN regional commissions. UN agencies have actively contributed to the consultations on the future of disaster risk reduction through the global platforms and regional ministerial meetings and platforms. A range of themes have emerged during these consultations. In this respect, the UN system would like to convey the following views on the post-2015 framework for disaster risk reduction. Firstly, it is essential that the new framework is coherent with the post-2015 Sustainable Development Goals and that any future agreement on climate change and any future agreement on climate change action. Secondly, the new framework should address all types of hazards which could result in disasters, including geological, hydrometeorological, technological, and biological hazards such as epidemics and pandemics. The link to societal hazards such as conflict, social unrest, and financial crises should also be considered because there are some commonalities in the approaches to managing the respective risks. Thirdly, key sectors and associated sectoral agencies that play vital roles in implementing disaster risk reduction should be essential to the new framework. Further information on the role of sectors such as health, water and sanitation, and agriculture in disaster risk reduction is available on the World Conference website to assist your deliberations. Fourthly, risk assessment and effective risk communication are fundamental for risk-informed development planning across all sectors. Moreover, risk governance should be promoted at the community, country, regional, and global levels to address the causes and consequences of disasters. In particular, the new framework should focus attention on support for implementation of measures to reduce disaster risks at a local level. It should ensure sustainable and risk-sensitive land use planning, infrastructure development, including critical facilities such as schools, hospitals and public utilities, the safety of industrial hazards, and water, land and ecosystem management. Sixth, existing and new national, regional and global international standards, guidelines and good practices in risk management should become a foundation in the future framework. 7. Vulnerable and marginalised groups need to be engaged as partners in taking action. This calls for inclusive policies and actions that empower and protect children, youth, women, elderly people, people with disabilities, migrants, and displaced and refugee populations. 8. The importance of the role of women as leaders in disaster risk reduction are considered integral to the future framework. And finally, disaster recovery frameworks at all levels should promote increased preparedness for disaster recovery and aim to integrate DRR into post-disaster reconstruction. As we move towards a new framework for disaster risk reduction, the UN system is committed to support member states. The strength of the UN system comes through the diversity of its work in many sectors of society, such as health, education, agriculture, water, meteorology, food security, and environment. Areas of expertise in the UN system which member states can draw upon include the following: risk assessment and communication, the development of norms and standards, including sector-specific standards, and building institutional capacity to govern risk and implement disaster risk reduction measures. The UN system can also assist with the application of a risk-based approach to disaster prevention, preparedness, response and recovery that establishes a basis for integrating all aspects of disaster risk management, including action taken by the humanitarian community. The UN system also has expertise in disaster preparedness and strengthening capacities and systems for disaster risk reduction in all key sectors, such as in agriculture, water, education, health, ecosystems management, and urban and rural development, as well as through partnerships with the private sector and civil society. The UN agencies can also provide technical assistance on information and communication technologies, promoting social and financial protection schemes, and science and research. In this regard, the UN system supports the proposed creation of an international science advisory mechanism to strengthen the evidence base for the implementation and monitoring of the new framework. Finally, we would like to emphasize that the UN system, the International Organization for Migration, and the World Bank remain at the disposal of member states as you elaborate the post-2015 framework for disaster risk reduction. Once agreement on this new framework is reached, the UN system will work together and provide the necessary support to enable countries and communities to achieve resilient and sustainable development. Thank you.
I thank the distinguished representative of the World Health Organization